How many people have to die so that you can keep your party together?
Last Friday night, the police showed up at his house, warning him of a death threat against him.
It's serious enough that the RCMP are involved.
I just want to thank you for still talking to me.
A humbled Dr. Dina Hinshaw addressed primary care physicians last night. Alberta's chief medical officer revealed this is her biggest moment of regret, being part of a decision to lift all COVID restrictions in the province. Hinshaw says that mistake set the province's relentless fourth wave in motion.
I think that trajectory was set when we removed all the public health restrictions at the beginning of July.
Hinshaw says she feels responsible for later giving the impression the pandemic was over.
That has had repercussions, and I deeply regret how that has played out.
The highest COVID ICU numbers ever in Alberta. Staffing shortages, surgery cancellations for everything from cancer to joint replacements. It's been 11 days since Premier Jason Kenney's last COVID briefing. But life and death decisions continue. Difficult choices based on the statistics of survivability.
When it gets like this, we can't take the long shot because we got to put our resources into people that we know are going to do the best.
That Dr. Marklin is even at work is a feat of resilience. Last Friday night, the police showed up at his house, warning him of a death threat against him.
It's serious enough that the RCMP are involved, but they will not disclose specifics. It's effectively like watch your back and don't get hit by lightning.
Combine that with protests outside the workplace and what he calls a leadership vacuum.
I honestly feel terrorized.
And yet he and so many others like him just keep showing up.
The Delta variant is blamed on the summer spike in COVID cases and hospitalizations, not just here in the Houston area, but across the country. And tonight we've confirmed that the Houston area has recorded at least several dozen cases of the newer Mu variant.
For starters, you look at the news feeds, the Mu variant is all the talk, but doctors tonight say that Mu is a concern, as the World Health Organization has said it is, but the biggest concern remains the Delta virus, or the variant that is, because of the punch it packs.
Every week it's going up. So we started 4 weeks ago. I think we had one patient in the ICU with COVID, and now we have 14.
And increasing by?
Probably 4 or 5 patients per week in the ICU, and certainly far more up on the ward. So this corridor down here is all of the COVID patients. Each one of these rooms has 2 people in it, and you can just walk in now. That whole console there is the ECMO machine.
And so what's that doing for that patient?
So it's basically taking over the entire function of his lung. So there's a catheter the size of a garden hose in his neck, and there's a catheter the size of a garden hose in his groin. And basically it takes the blood out of his groin, puts it in the machine, takes the carbon dioxide out, puts the oxygen in, and then pumps it back into his heart. And so basically completely takes away the function of his lung and does it for him.
That's lung failure from COVID.
From COVID.
So these are 2 COVID patients on life support.
On advanced life support, both are unvaccinated, and both are on the highest level of life support you can get anywhere. If you get sick with COVID and you get really sick, it doesn't matter how young you are, it doesn't matter how healthy you are, you could very well end up here. And once you end up here, your chances of survival are limited. It's frustration with the individual choice that the patient made. It's anger with the social context that got them to make that decision. It's anger with people posting on social media that COVID's not real or that vaccines don't work. That basically preys on vulnerable people who are trustworthy and forces them to make bad decisions that in some cases are lethal. And we see that here. And so this young man was totally healthy. It's very scary.
That's okay.
I don't even think we're at the crest of the 4th wave. I think the wave is building. So I think it's going to get worse.
But boy, is that ever heartbreaking when you see the trickle-down effects, the ripple effects of what is happening in Alberta. How do you talk to your patients about that?
So, for months now, we've been counseling patients that effectively they've been abandoned by the government and that they need to be taking measures to protect themselves. So this was initiated in July when the government announced that they would be dropping test, trace, and isolate, which is basically a way of bringing down cases in the community and to protect our patients from themselves becoming infected. Now that the Delta wave has torn through our communities and our ICUs have completely filled up with the government not doing anything until far, far too late, it's the same conversations. We stress that it's important to get vaccinated, that we're still going to look after them even if they're not vaccinated, but really we need to do everything we can to try to alleviate the burden on the healthcare system right now.
I think that's such an important point that some people don't seem to recognize, that the idea was not to completely eradicate COVID, because that's not necessarily possible anymore with the variants. The idea is to not overwhelm and crush the healthcare system, which seems to be what is happening right now in Alberta.
Yeah, and clearly what happened is, our Chief Medical Officer of Health and our Minister of Health and our Premier took their eye off the ball in the summer. They had concluded based on cherry-picking data that there would be a decoupling between the number of cases of COVID infection and the number of severe outcomes like hospitalization. And so they didn't revisit that assumption as cases started to increase in our hospitals and in our ICUs. And we were met with radio silence when we were calling for interventions, and that was over a month ago. And now it's important to stress that the situation we're in it's not just on the verge of collapse. Our system has collapsed. As you heard from that clip, if we're no longer able to offer surgical care to anybody but the most severe cases, defined as life and limb saving, what kind of healthcare system is that? We're turning away. We're basically on the cusp of requiring to institute a triage protocol, which moves decisions on who will be able to access life-saving care from individual clinicians to a protocol.
It didn't happen overnight, rather a gradual process as national immunity was built. After 548 days of COVID curbs, Danes are living like it's 2019.
No restrictions whatsoever. That's nice.
It's really nice to have my sort of like social life back.
A country of 5.8 million people with around 500 new cases each day. More than 80% of the population aged over 12 is fully vaccinated.
And as a consequence, we have the pandemic under control in this country and can therefore handle whatever remaining of those who still get infected within the frameworks of our hospital system.
A vaccine passport was introduced in March this year. Now it's no longer required for entry into venues, including nightclubs. Masks are only mandatory at airports, and today a sold-out concert in Copenhagen will welcome 50,000 people.
Today we're outside the Civic Hospital in Ottawa on Carling Avenue, and I'm here to support the wonderful medical staff that we have in our hospitals. Nurses, the doctors, the support people, the administrative people, they're all great. Sadly, I've had occasion to use these hospitals for family members and myself, and I am so impressed with everything they do. And I feel it just unbelievable that they will be, some of these people that have dedicated their lives to people here in Ottawa are being threatened with unemployment because of a medical choice that they want to make. Nobody's been forced to take any medications in the past with the threat of unemployment. That's just wrong. It's morally reprehensible. Even not telling people whether they've had the jab or not. It's their choice. It's their body, their choice. They can have the jab or not. They should not be forced to divulge that. They should not be forced to divulge any medical information. That's in our statutes, for goodness sake. It's in our contracts. It's in our labour laws. It's in our human rights code. You can't force people to divulge medical information.
I can't understand this. If you're against vaccines, okay, but protesting a hospital where sick people are, where people are dying, where people are trying to treat those, I don't understand the message here. And to me, it's beyond reprehensible doing this when people are at their most vulnerable state walking through those doors. Take it elsewhere, take it to Parliament Hill, take it to Queen's Park, take it to your local MP's office. You don't do it at a hospital.
It's to do with freedom of choice, and it's to do with our, under the Charter of Rights and Freedoms, exactly that, our rights and freedoms.
Turning now to that ruling from a federal judge impacting all healthcare workers across New York State. The judge today temporarily blocking the state from forcing medical workers to be vaccinated. This comes after a group sued, saying their rights were violated because the state's mandate did not allow religious exemptions. The judge giving the state until September 22nd to respond. The state issued this order back in August, requiring at least a first shot for healthcare workers at hospitals and nursing homes by September 27th. More than 75% of the 450,000 hospital workers statewide are vaccinated here in Western New York. Oishei Children's Hospital has the highest staff vaccination rate at 100%. Mercy Hospital and Orchard Park facility has the lowest at 56%. Some local healthcare leaders say the vaccine mandate could be a disaster. One hospital already dealing with resignations and worries another wave could force them to shut down some services.
The devastation for the community is going to start, first.
Spokesperson for Olean General Hospital, Dennis McCarthy, confirms 11 staff members have quit because of the vaccine mandate issued by the state last month that is now temporarily blocked. 68% of their staff is vaccinated, but more than 250 employees still haven't gotten the shot.
I do believe that 11 is just scratching the bare minimum of nurses who are going to resign.
Trisha Sebastian is one of the unvaccinated ICU nurses at Olean General Hospital who will lose her job if the vaccine mandate is put back in effect.
But are you scared for your job? I am scared for my job. I'm a single mother. I have 4 children. I went to school. I paid to go to school to become a nurse.
So you would possibly go to another state that doesn't have this mandate?
Correct. I'm going to continue to travel and I'm going to find facilities that are accepting of unvaccinated nurses.
We have been vaccinating our children for a long time against polio, measles, mumps, and chickenpox. So why is the COVID-19 jab for children controversial? Is it safe to vaccinate children? Cuba has become the first country to give COVID vaccines to children as young as 2 years old. They'll get a Cuban-made vaccine the outside world knows little about. While children are still less likely to be hospitalized or die from COVID, Cuba has decided it won't take any chances, even as other countries might view giving vaccines to toddlers as the riskier choice at this stage.
Children as young as 2 are getting vaccines developed in the National Institute in Havana, the youngest people anywhere to be jabbed against coronavirus. Decades of international sanctions have left communist Cuba isolated, a factor in its decision to develop its own vaccines instead of joining the COVAX initiative run by the United Nations.
I want to get vaccinated in this trial to help my friends from school to get vaccinated too, so they don't get coronavirus.
Although the vaccines are not fully proven, the government is speeding up inoculations in the hope of reopening schools after an 18-month shutdown.
The choices that leaders make in a crisis matter.
Today, Justin Trudeau tried to tie his main rival to the Alberta Premier's handling of the pandemic.
Just a few days ago, Mr. O'Toole was still applauding Mr. Kenney for his management of the pandemic. And that's at the heart of the choice Canadians need to make in this election.
And the Liberal leader asked a question he hopes voters might ask themselves.
Do you really want Erin O'Toole to be sitting across from them at the Premier's table talking about how we end this pandemic when he himself can't stand up to the anti-vaxxers in his own party?
But Trudeau faced a question of his own. Why didn't he intervene to help Albertans?
It's not my job to judge or to criticize or to certainly not to tell people what to do at the provinces. They are duly elected.
Trudeau's closing arguments in these final days centers around trust. He's trying to drive home his message that his party is the only one that can be trusted to fight the pandemic.
He's repeatedly applauded Jason Kenney's handling of the pandemic. Today, Aaron O'Toole was repeatedly asked if he still does.
As Prime Minister, I will work with all premiers, regardless of strike, to fight against the pandemic. A pandemic that we need to fight. And Mr. Trudeau didn't fight. He called an election, a $600 million election.
I think Canadians are sitting at home wondering about the pandemic itself, not specifically about this election. Who do you think did a better job handling the pandemic? Provincial Premier Jason Kenney or Prime Minister Justin Trudeau?
Canadians are sitting at home, as you said, wondering why we're in an election.
No, I asked about who handled the pandemic better.
Question after question answered with talking points, but no mention of the Alberta Premier by name.
Trudeau spoke out about Kenney today. Singh spoke out about Kenney today, and O'Toole pretended he'd never heard of Jason Kenney today.
The Conservative leader trying to walk a fine line with 4 campaign days left to go.
The government of Saskatchewan has been very patient. Possibly we have been too patient, and that time for patience is now over. The choice to not get vaccinated is not just affecting you, it is now seriously impacting those that had made a different choice. Some will say that the government has made poor decisions all throughout this. Some will say the government has went too far. Some will say the government has not gone far enough. No, with respect to the decisions that we're making here today and the decisions that we have made throughout this pandemic, what I would say is that this government has attempted to make the very best decisions that we can collaboratively with these two gentlemen on the screen here, Dr. Shahab, Scott Livingston, as well as others. In the best interest of the people of the province with the information that we have available to us at that point in time. I've just told you that with all of the decisions that we've made throughout this pandemic, some will view them as not being the correct decisions, some will view them as being the correct decisions. Hey? Listen, the decisions that we've made here today, I believe are the best decisions for this point in time. I think I'd explicitly said at that July 11th, in that press conference leading up to July 11th, that this is not a mission accomplished, that we are still living with COVID as we look out to the months and the weeks and months ahead. By no means did this government put forward that COVID was over. I had specifically said in those notes at that point in time that this is not mission accomplished. This Sunday, after 485 days of public health orders and restrictions being in place, after 485 days of the government telling you how to live your life, all of those restrictions will end. Now, as you can see, there's no mission accomplished banner that is hanging behind me, and that's because although the restrictions are coming to an end, COVID is not. On July the 12th, we will report a number of COVID cases, and we will have vaccinated, yes, many thousands more people than what we have today. This fight against COVID does need to continue, but it will shift into a new and somewhat different phase. Instead of trying to control the COVID infection rate through government-imposed restrictions and government rules, we can now control COVID through vaccines. There is still work for us to do, but we do have the opportunity, and I think we have had the opportunity to have a great summer, largely outdoors.
Political analysts are coming down hard on the UCP government to prioritize people over party unity.
How many people have to die so that you can keep your party together, right? You often hear, wealthy people, in hospitals saying, money can't buy you health. Well, neither can party unity. I don't know how they can survive.
Some experts are also saying that Kenney's silence is being used as a tactic to protect the federal Conservatives during the campaign. And yesterday, Prime Minister Trudeau actually took aim at Kenney's leadership, saying he feels bad for the millions of Albertans that have been vaccinated.
With the very latest on Alberta, the province now under a state of public health emergency, and Premier Jason Kenney is warning the still surging fourth wave is pushing Alberta's healthcare system to the brink.
We may run out of staffed intensive care beds within the next 10 days. Unless we slow transmission, particularly amongst unvaccinated Albertans, we simply will not be able to provide adequate care to everyone who gets sick.
Kenney's warning that hospitals could soon be overwhelmed came just hours after the province reported a new pandemic record for COVID patients in ICUs. As we look at the map, a key data point, Alberta's active case rate, 417 cases per 100,000 people. It remains the highest in the country. Now the Premier is reestablishing COVID restrictions he lifted in July triumphantly and doing something he has resisted until now, bringing in a vaccine passport.
Well, good afternoon, everyone, and it really is a good afternoon. This is a happy day for Alberta. Some fantastic news for all Albertans. Yesterday, Alberta officially surpassed the 70% vaccination threshold to trigger stage 3 of Alberta's Open for Summer plan, with 70.2% of eligible Albertans receiving their first vaccine dose. And that means that on July the 1st, on Canada Day, Alberta's public health measures will be lifted and our lives will get back to normal.
This has been a Wolfie Terrier 2021 production.